Chapter 7 is Medicaid and other state programs. Our key objectives for this chapter explain what the Medicaid program is, discuss the history of Medicaid, describe added benefits for Medicaid recipients afforded by the Patient Protection and Affordable Care Act and the Healthcare and Education Reconciliation Act of 2010, discuss the different types of Medicaid programs, discuss how Medicaid is administered by state government, identify those eligible for the Medicaid Qualified Medicare Beneficiaries Program. Name and describe the two Medicaid eligibility classifications. Discuss a healthcare organization's responsibility as a participant in the Medicaid program. List valuable information to abstract from the patient's Medicaid card. Describe the Medicaid basic benefits. Explain basic operations of a Medicaid managed care system. Explain basic Medicaid claim procedure guidelines. File claims for patients who have Medicaid and other coverage. Interpret and post a remittance advice. Describe filing an appeal for a Medicaid case. And explain the purpose of the Medicaid Fraud Control Unit. Starting off with the history, between 1933 and 1935, the Federal Emergency Relief Administration made funds available to pay the medical expenses of the needy and unemployed. And the Social Security Act of 1935 set up the Public Assistance Program. In 1950, Congress passed a law mandating that all states set up a health care program of assistance. DEFRA, the Deficit Reduction Act, was created in 1984, while the Fiscal Responsibility Act, known as TEFRA, of 1982, set down laws affecting those under the Medicare program as well as Medicaid recipients. Medi-Cal, this is Medicaid Program of California. And then we also have the Patient Protection and Affordable Care Act and Healthcare and Education Reconciliation Act. The Patient Affordable Care and the Healthcare and Education Reconciliation Act was passed in 2010. It expands access of Medicaid for childless adults and non-elderly and non-pregnant individuals. It includes preventive services and long-term care benefits. And additional funds were allocated for maternal and child services. Beginning in January of 2014, Medicaid eligibility limits increased so that adults earning up to 138% of the federal poverty level were eligible. States were given the choice to expand, and as of 2014, 18 states were not expanding, 30 states were expanding, and 3 states were expected to expand, but using an alternative to traditional expansion. The Medicaid programs. Title 19 of the Social Security Act provides a program of medical assistance for certain low-income individuals and families, as well as primary or supplemental coverage for people with disabilities, known as Medicaid in 49 states and Medi-Cal in California. Medicaid is administered by states with partial federal funding. Each state designs its own Medicaid program within the federal guidelines. Arizona is the only state without a Medicaid program similar to those that exist in other states. Since 1982, Arizona has received federal funds under a demonstration waiver for an alternative medical assistance program for low-income persons called the Arizona Healthcare Cost Containment System, or CCS, and we pronounce that as access. The MCHP, known as the Maternal and Child Health Program, provides federal funds to states to enable them to do the following: provide access to quality maternal and child health services, reduce the incidence of preventable diseases and handicapping conditions among children, increase the number of low-income children receiving health assessments and follow-up diagnostic and treatment services, and provide prenatal, delivery, and postpartum care for low income children. The MCHP provides federal funds to states to enable them to provide preventive and primary care services for low income children, provide rehabilitation services for the blind and disabled younger than 16 years of age, and promote, and develop family centered, community based, coordinated care for children with special healthcare needs. Low income Medicare recipients. We have We have the Medicaid Qualified Medicare Beneficiary Program. This is for what we call QUIMBYs. The elderly and disabled below the poverty line. They pay Medicare Part B premiums, deductibles, and copays. Then we have SLIMBYs, the specified low income Medicare beneficiary. These are those that are eligible include the elderly, who are 20% above the federal poverty line. SlimBees pays the Part B premium, and the patient pays Part B deductibles, copays, and non covered items. Then we have QIs, qualifying individuals. They may be 135% above the poverty line, but less than 175%. QI pays the Medicare Part B premium. Medicaid eligibility. Those eligible for Medicaid include the elderly, 65 and above, blind disabled members with dependent children with minimal support, low income resources, U.S. citizens, or qualified immigrants. Categorically needy, which are the aged, blind, or disabled individuals or families and children who meet financial eligibility requirements. The medically needy, persons in need of financial assistance whose income and resources will not allow them to pay for the cost of medical care. The Maternal and Child Health Program provides benefits to children who have some kind of handicap that requires orthopedic treatment or plastic surgery, and some additional conditions. The Spousal Impoverishment Protection Law affects special financial provisions in Medicaid for the elderly, blind, or disabled. And the New Freedom Initiative aims to remove barriers to community living for people of all ages with disabilities and long term illnesses. Specific conditions qualify a child under MCHP, again, Maternal and Child Health Program. All state laws include children who have some kind of handicap that requires orthopedic treatment or plastic surgery, and a few states have other conditions. So these can include cerebral palsy, chronic conditions affecting bones and joints, cleft lip, cleft palate, clubfoot, cystic fibrosis, epilepsy, hearing problems, mental retardation. Also, multiple handicaps, paralyzed muscles, rheumatic and congenital heart disease, and vision problems requiring surgery. Accepting Medicaid patients. A provider must enroll for participation in the Medicaid program by signing a written provider agreement, depending on state guidelines with the fiscal agent, local public service welfare office, human service agency, or family interdependence agency. The POS or point of service machine connects to state system to verify Medicaid coverage using the information from their insurance card. Retroactive eligibility refers to a patient who receives medical care while applying for Medicaid. They should be treated as a cash patient. Once Medicaid approves eligibility and sets a retroactive date for coverage, the patient should be reimbursed for any costs that would be billed to Medicaid. Medicaid benefits. Covered services are listed on page 434 and include family planning, home health care, immunizations, inpatient hospital care, laboratory and x ray, outpatient hospital care, physician's care, screening, diagnosis, and treatment of children younger than 21 years of age, skilled nursing care, transportation to and from healthcare providers. And in some states, additional services included might be allergy care, ambulance services, certain medical cosmetic procedures, chiropractic care, clinic care, dental care, dermatologic care, diagnostic, screening, preventive, and rehabilitation services, for example, physical therapy, emergency department care, eyeglasses and eye refractions, hospice care, intermediate care, occupational therapy, optometric services, podiatric care, prescription drugs, private duty nursing, prosthetic devices, psychiatric care, respiratory care, and also speech therapy. Early and periodic screening, diagnosis, and treatment is for identifying problems early on, starting at birth. Periodic for checking children's health at periodic age appropriate intervals. Screening is for doing physical, mental, developmental, dental, hearing, vision, and other screening tests to detect potential problems. Diagnosis for performing diagnostic tests to follow up when a risk is identified, and treatment for treating the problems found. For disallowed services, the physician can bill the patient in most states. Medicaid managed care. States have brought managed care to Medicaid programs. It helps control escalating health care costs, curbs unnecessary emergency department visits, and emphasizes preventive care. Some states have adopted capitation, a flat fee per patient, rather than a fee for service reimbursement. In programs run for a number of years, it has been found that there is better access to primary health care and savings of money in delivering the care if the programs are well managed. Claim procedures include co-payments, prior approval, time limits, and reciprocity. Some complexities are related to Medicaid claim procedures, and the specifics are detailed by the state. You'll want procedures in place to ensure the right protocols, procedures, forms, and documentations. Copays depend on the patient's status. For example, emergency care and pregnancy services are exempt from copay requirements for the medically needy. Be aware of time limits for submitting the claim. They are set by each state. If you see out of state patients, most states have interstate agreements in place. You should contact the Medicaid intermediary from the patient's home state. When filing a claim for Medicaid managed care patient, send the bill or claim form to the managed care organization and not to the Medicaid fiscal agent. Each state's jurisdiction operates its own maternal and child health program with its own unique system and forms for billing and related procedures. It is possible that a person can be eligible for Medicaid and also have a group health insurance coverage through an employer. When Medicaid and a third party payer cover the patient, Medicaid is always considered the payer of last resort. When a Medicaid patient has Medicare, TRICARE, or CHAMP VA, always send the insurance claim first to the federal program servicing the region and then bill Medicaid second. This figure shows an electronic explanation of payment or EOP agreement used by the Medicaid program in Alabama. It must be completed by a provider and it authorizes the fiscal agent to transmit EOPs to the physician's electronic mailbox. Remittance advice accompanies all Medicaid payment checks sent to the physician. For appeals, the Time limit to file varies state to state. It's usually 30 to 90 days from the date listed on the remittance advice. The pathway of appeal, regional fiscal agent or Medicaid bureau, then to the Department of Social Welfare or Human Services, and lastly to the appellate court. Our summary for this chapter: Medicaid was established by Title 19 of the Social Security Act, a federally aided, state operated, and state administered program that provides medical benefits for certain low income persons in need of health and medical care. Medicaid is administered by each state's government with partial federal funding. The Patient Protection and Affordable Care Act and the Healthcare and Education Reconciliation Act, passed in 2010, affect the Medicaid program by expanding access for childless adults and non-elderly and non-pregnant individuals, and including preventive services and long-term care benefits. Coverage and benefits vary widely from state to state. Each state operates a children's health insurance program with federal support under the Title V excuse me, of the Social Security Act. Some federal acts allow assistance to qualified Medicare beneficiaries, known as QUINBEs, and specified low-income Medicare beneficiaries, known as SLIMBEs, who are aged or disabled and receiving Medicare but have annual incomes below the FPL, federal poverty level. A medically needy Medicaid classification may or may not pay a deductible, copay, or share of cost within a specific time frame before receiving state benefits. Healthcare organizations and providers must enroll for participation in the Medicaid program with the fiscal agent or local public service welfare office. Medicaid benefits identification cards are issued monthly to recipients. Medicaid eligibility must be verified before providing medical services to patients. Some patients may have retroactive eligibility. Sometimes prior approval is required for medical services and procedures. Each state may have a different time limit for submitting a claim for reimbursement. The CMS 1500 insurance claim form has been adopted for processing Medicaid claims in all states to a regional fiscal agent. An RA remittance advice or check voucher accompanies all Medicaid payment checks sent by the fiscal agent to the provider of services. Each state has a Medicaid Fraud Control Unit, MFCU, that investigates and prosecutes cases of fraud and other violations, including complaints of mistreatment in long-term care facilities.